It's hard to know exactly how to handle each case. It's probably best to talk to your supervisor and handle it on a case-by-case basis. But certainly if you feel like the life of patients may be somewhat on the line because of a physician's irresponsibility, then it's important to report them and let a medical board at least do an investigation, because in the long run it's only going to help them and it's only going to help their patients. Disciplinary action, basically impairment is the main reason that physicians get disciplined. Every year about 125 of us get disciplined for this. Out of all the reasons to get disciplined, impairment's the major one. There's also programs called like the Physicians' Health Programs, which are out there to, if you have problems with alcoholism, addiction, or mental illness, you can, if you seek treatment before any major consequences happen, that's a good thing. You don't even have to have any board involvement. I kind of skipped this step and went straight to board involvement, but if you do this, it's confidential, and it can be very worthwhile because it can get you the treatment that you may be able to benefit from without having all the black marks following you for the rest of your career. So the first bite is what it's called if you do have, let's say you have a second DUI. First DUI, really that should be a warning sign to anybody who has a DUI or major consequences to alcoholism. But first bite will help out people who have a second DUI if they report it and seek out treatment. Case report of a surgeon who I go to caduceus with every week. He got his second DUI, and now he voluntarily engages in alcohol and drug treatment so he doesn't have to get board involvement. 53-year-old neonatologist who got started on Percocet for back pain actually got so addicted when it was taken away she started forging prescriptions. Again, as I implied earlier, if this is more severe consequences, she got felony charges, which she later got dropped to guilty in lieu of treatment, but her license was suspended not for 90 days but for 2 entire years. So she's still not back to work as a physician. So addiction is definitely something that can destroy your life and your career, so try to avoid it as much as possible. In regards to mental illness, there's a lot of reasons to be hopeful out there. There's a lot of research. People are coming out advocating for the importance of mental health treatment. Celebrities are coming out about it. And there's now the American for Disabilities Act, which if you ever feel your job was in jeopardy or you were ever fired from a job for what you feel to be mental illness or alcoholism or drug related, the American Disabilities Act is there to protect you, because as long as you receive appropriate treatment, your job has really no right to fire you for this. And so what should you try to do with all these questions? Again, it's something you can only answer yourself. But what I would recommend is, if you have a pure mental illness, I'd recommend seeking out appropriate treatment. Take sick leave if you need it so it doesn't evolve to the point where other people end up reporting you. And again, the medical board only considers you impaired as if your illness interferes with your ability to practice. In regards to alcoholism and addiction, I really recommend seek treatment as soon as possible. If you have consequences that could potentially throw up red flags, try to utilize the first bite physician effectiveness programs, because addiction left unchecked will eventually evolve to consequences that will interfere with the life of your patients, your own life of your family. Everything will start to spiral down if you don't at some point start to get the treatment you need. I'm going to briefly read through something that I share as a part of my lead when I go to AA and NA programs. It dates back to when I first was handcuffed in front of the hospital I was working and taken away with all my physician friends and nurses looking on. Basically, after this incident, I was mandated by the state medical board to undergo a drug and alcohol evaluation. I was told by another doctor that in order to save my career, I have to tell them that this was a momentary lapse of judgment and deny any history of chronic alcohol or drug problems whatsoever. I remember feeling really scared, like my life was coming to an end. I felt like I had to do or say anything to save it, so I concocted a fairly believable but totally untrue story about my life. Now, the evaluation was mandated to be 3 days long and included psychological testing and interviews with a psychiatrist and an addictionologist. For the first day and a half, I totally stuck with my story, but finally I interviewed with the addictionologist who said point blank, "I don't believe a word you're saying." He went on to say, "I think you're an alcoholic or an addict or both. And trust me, I should know because I'm one too. The only difference is that I have long accepted this fact and have allowed myself to receive treatment and move on. He said, "What are you trying so hard to save? Is that life of yours really that great that you are willing to repeatedly deal with all this crap you're putting yourself through?" He also caught me in a couple of lies and said, "Isn't it exhausting what you're doing? Come on, Mark, just throw in the towel. When you're an addict, you'll never know what it feels like to win until you surrender." It had been over a month since my last drink, but up to that point I still didn't get it. Even though I was a psychiatrist who worked with alcoholics and addicts, I could see problems in everyone but myself. Something about what the addictionologist said really stuck with me, and I began to ask myself, is all this really worth it? What am I doing? And that night, while I was in a rehab center, I literally broke down and started sobbing and asked for help. I didn't know to who or what I was talking to, but I remember saying, "I really have screwed things up and I must be an alcoholic, so please help me." Almost immediately, like a light switch was flipped, I began to realize how crazy the last several years of my life had been. Like the fog was starting to clear, this precious party life that I was so desperately trying to preserve was recognized to be nothing more than a chaotic heap of heartache. I realized that in my quest to enjoy life, I had become miserable. This all happened on the night of my 34th birthday, and the next day I attended a treatment team meeting, and that was the first time I was able to muster up those terrifying words in public and actually identify myself as an alcoholic and an addict. A quote I always used to rationalize my drinking was, "Don't fear death, but rather fear the unlived life. You don't have to live forever, you just have to live." For the first time in my life, I began to realize that when I was drinking and drugging, I wasn't living life, I was escaping it. So the addictionologist diagnosed me with alcohol dependence and polysubstance abuse, and I was referred to a 28-day program. I lost my job and I temporarily lost my medical license, but in the process, my life was